Hello, everyone. Welcome to our first case scenario, loading, and of course, this is going to be medical ward of Jarabar General Hospital, and we will be on a PM shift. And of course, I'm actually with you guys for BSN 3B, group number 1 for Wednesday and Thursday schedule of clinical duty. But of course, today we'll focus on a virtual duty since this is in response to the pandemic that we're actually experiencing today. So my name is Joseph Bahian Abang, and of course I will be your clinical instructor for the remaining 3 weeks of this rotation. So let's begin with your uh, case scenario. I am here for you. It's literally my life's work to help you grow. Of course, I will help you grow, and of course you will also help me grow as a professional individual. So we will be together in this journey in order to learn things together, because this is a journey. We have one direction. Before we proceed to our case scenario, it is but right for us to have our learning outcome, since this will be the basis for the evaluation of the expected output that we're going to have at the end of this case scenario. On completion of this case study, student nurses will be able to first build knowledge related to the patient's medical experience, continue to develop a comprehensive assessment and monitoring skills. Third is recommend nursing interventions based on the case presented. Fourth, define the roles and the contributions of student nurses in the care of medical patients. Fifth, justify optimal therapy based on the current understanding of the case. So this will be the 5 learning outcomes that will be the basis of our case scenario for today. Instruction. So this instruction is very important because of course this will be the basis also for me to give you a grade, especially if you know how to follow instruction, and at the same time the output that you're going to submit every day or it's going to be for a weekly basis. So instruction first is all critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, and there has to be no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Fourth, base all your answers on the data that is presented and do not assume information that is not provided in the case. So of course, you always base all your answers on the case that is presented and do not assume that there is lacking information within the case. Next is, please follow the format of your output, especially on its font style, font size, paper margin, and paper size. So I have already sent you a copy of the templates that you're going to follow for your daily requirements, and of course you have also received a template of the weekly requirements that you are going to submit at the end of the week. Next is save it as PDF file and submit all your requirements per group on date specified, and as its deadline, of course, we'll choose a leader from your group who will actually be assigned to send me the entire output of the entire group on or before the scheduled deadline. Send all your requirements by the official email address of your clinical instructor, and of course you will know that one later. It is advised that you will submit all your requirements on or before the set deadline of submission. So it's expected that you are going to submit all your requirements before the set deadline. So now let's proceed to the case that you're going to be handling for the 2 days virtual duty. And of course, your case is a case scenario of patient EF with hepatitis. EF is a 24-year-old house painter from Alubid, Misamis Oriental, has been too ill to work for the past 3 days. When he arrives at the outpatient clinic of Maria Reina Xavier University Hospital with his girlfriend, he seems alert but acutely ill, with an average build and a deep tan over the exposed areas of the skin. He reports headache, joint pain and low-grade fever, cough, anorexia and nausea and vomiting, especially after eating any fatty food. EF describes vague abdominal pain that started about the same time as the other problems. His past medical history reveals he has no health problems, is a no smoker, and drinks a few beers each evening to relax. Vital signs are blood pressure of 128/84 millimeters mercury, pulse of 88 beats per minute, respiratory rate of 26 cycles per minute, temperature of 100.6 degrees Fahrenheit or 38.1 degrees Celsius, awake, alert, and oriented for the three spheres, moves all extremities well except for aching pain in his muscles. Very slight scleral jaundice is present. Heart tones are clear and without adventitious sounds. Bowel sounds clear throughout abdomen and pelvis, and abdomen is soft and palpable without distinct masses. You note moderate hepatomegaly measured at the mid-clavicular line. Liver edge is easily palpated and tender to palpation. EF mentions that his urine has been getting darker over the past 2 days. EF is manifesting the key signs of hepatitis. Lab work is sent for identification of his precise problem, and results are shown below. So the following are the laboratory results. Sodium of 140 MEq per liter, potassium of 3.9 MEq per liter, chloride of 102 MEq per liter, carbon dioxide of 26 milliequivalent per liter, BUN of 10 mg per deciliter, creatinine of 1.0 mg per deciliter, platelets of 210,000 cubic millimeter, indirect bilirubin of 1.6 mg per deciliter, total bilirubin of 2.3 mg per deciliter, albumin of 3.8 grams per deciliter, total protein of 6.5 grams per deciliter, ALT of 66 units per liter, AST of 52 units per liter, LDH of 245 units per liter, alkaline phosphatase of 176 units per liter, prothrombin time versus INR is 12 seconds versus 1.06 seconds, APTT of 32 seconds, urine urobilinogen of 1.6 international units per liter, anti-hepatitis A virus or IgM negative, hepatitis B surface antigen that's positive. EF is ready for discharge in a few days, and he confides in you that he feels so guilty about having hepatitis and endangering his girlfriend and family. He tells you that he was at a party and did not think the one-time needle use could hurt him. He has been told that he has lost his job because he is not able to go back to work, and he hopes his family is not too afraid to have him return home. The following day, EF was seen and examined by Dr. GH with the following home medications prescribed: tenofovir, your disoproxil, Vired 500 mg OD, Monday and Tuesday, PO. Entecavir, that's Baraclud, 500 mg OD, Wednesday, Thursday, PO. Tilbivudin, or your Tyzica or your Zivivo, 500 mg OD, Friday and Saturday. Adifovir, your Dipivoxil or Hepcera, 500 mg OD, Monday, Wednesday, PO. And then Lamivudin, Heptudin, 500 mg OD, Wednesday and Thursday. So that is the case history of patient EF. Let's proceed now to the critical thinking questions. So this will be requiring you to answer, and of course you have to submit as brief answer as possible. First question is, which key diagnostic test will determine exactly what type of hepatitis is present? Second, which of EF's lab results listed previously specifically indicates liver disease? Third, what is the difference between hepatitis B surface antigen and hepatitis B surface antibody? Number 4, considering the basic pathology of hepatitis, what type of diet will you strongly encourage EF to follow? And 5th, pruritus is usually associated with jaundice. What will you do to ease this problem for EF? So these 5 questions must have to be answered and must have to be submitted as last deadline. Let's proceed now to the daily duty requirements. For day 0, supposed to be day 0 is Wednesday, So on Tuesday, so you have to have your case scenario loading so that will actually be implemented the following week. Let's have now the day one. So day one, you have to submit your GO, SO, DPA, physical assessment, pathophysiology, drug study, and nursing care plan. For day two, specific objective, DPA, CRA for day one, sample nurses notes, FDAR of day one and day two, and discharge plan reflective journal reading. Then for week one, follow the case study written requirements. For case study requirements, these are the contents. First, you have to have a simple introduction. It will be followed by nursing health history, physical assessment. Of course, it will be followed by the anatomy and physiology. Pathophysiology follows that one, and of course, it will be followed by diagnostic tests. We have your drug study, problem lists, nursing care plan, discharge plan, learning outcome, and of course, your reference. Please make sure that your references utilizes your APA method or APA style of reference taking. So that is going to be the content of your case study. Deadline of submission for the daily requirements. For day one requirements, you are expected to submit your requirement February 4, Thursday, 11:59 p.m. For day two, you have to submit that one February 5, 2021, Friday, 11:59 p.m. And then for your weekly requirement, you have to submit that one February 8, 2021, that's Monday, 11:59 p.m. So I'm expecting an email from your team leader on these dates, on or before the set deadline. We are all on our own journey, but in this class, we all need one another and will help one another grow. So of course, this is a journey. This is a collective journey of everybody. So therefore, we hope that we will all learn from each other. This will be my contact details. Mr. Joseph Bahian Abang, and you can email me at jabang@xu.edu.ph, or you can actually send me a text message at 0931-042-9842, or you can follow me in my social media accounts. This has been Joseph Bahian Abang at your service to make your best better. Thank you. To God be all the glory. Bye for now. See you again.